that text box. All right, so let me introduce our host for today's webinar, DSK Rao. He was a senior executive with NABARD before joining the Microcredit Summit campaign 16 years ago. In his long association with the campaign, DSK has worked closely with several MFIs in Asia, particularly in India and Bangladesh. In recent years, in partnership with Freedom from Hunger, DSK has been working with, for the last 6 years in India with MFIs to promote health, developing new health education modules, helping to design new means of measuring client health outcomes, and providing TA for implementation. He has been conducting training programs to MFIs on various health modules related to water, sanitation, and hygiene, or WASH, and women and child health. For the last 8 months, DSK has been working tirelessly to promote the community of practice of health and microfinance in India. He has worked hard to create the community of practice platform. Let's hear from him the work done so far and the next steps involved in this exciting journey of forming a successful consortium of players from these two diverse sectors. DSK, the platform is yours.
Warm welcome to all the participants. Thank you very much for being here. Today's presentation's agenda is Community of Practice of Health and Microfinance, Concept and Membership. What the organizers have done so far in promoting COP, highlights of our listening tool with potential members, COP activities planned for the next 4 months. Next slide, please. Just the next slide. Okay, thank you. Some of you may be already knowing about the recent changes in Microcredit Summit campaign. For the benefit of those not aware, I would like to inform that Microcredit Summit campaign, known the world over for the well-attended global and regional summits it used to conduct, has ceased to exist as a standalone operation and is now merged with Results Educational Fund, the parent organization. Results is a US-based grassroots advocacy organization working to create the political will to end hunger and poverty. Results works for long-term solutions to poverty by supporting programs that address poverty's root causes, such as lack of access to healthcare and education. The Financing Healthier Lives program of the Microcredit Summit campaign will now be implemented under the banner of Results. Freedom from Hunger, another US-based nonprofit, works in 14 countries of Africa, Latin America, and Asia, including India. Credit with Education, and Microfinance and Health Protection are two important projects of Freedom from Hunger. Freedom from Hunger has special focus on India and has floated a trust, India Trust, 3 years back with their head office at Delhi. One of Freedom from Hunger's important contributions is excellent education modules, health education modules, prepared for credit group members, developed, tailored to the needs of self-help group members and clients of microfinance institutions. The uniqueness of Freedom from Hunger modules is the use of adult learning principles. Several MFI partners in India who have used these modules have seen in their clients not only enhanced awareness but also sustainable change in the health-seeking behavior and practice. Freedom from Hunger and Microcredit Summit campaign, presently Results, have formed an alliance to promote health on the platform of microfinance. This global alliance is initially focusing on India and hopes the learning and experience from India would help them in their global efforts. Next slide. Next slide. Thank you. So I would like to show here the work the Microcredit Summit campaign and Freedom from Hunger have done in India. Please note that in my presentation, whenever I refer to MFI, I mean not only microfinance institutions, but also the NGOs and the state governments which are promoting self-help groups. So this MFI is to be understood in that context. The Health and Microfinance Alliance has worked in India for 5 years now, and during this period partnered with 21 microfinance institutions, including NBFCs and today's small banks like Bandhan, Equitas, SKDRDP, ESAF, Gramavidyal, in addition to NGOs and the state governments of West Bengal and Maharashtra. The Alliance has cumulatively reached 1.2 million women and adolescent girls in 11 states of India with diverse health products. The most popular and most extensively used product is education, health education on women and child health and WASH. Next slide. What is COP, community of practice? Typically, a community of practice is a group of people who share a common concern or passion, coming together or learning from one another. In our context, the passion we all share is the improved health of the poor. There are challenges in your work, no doubt. One common challenge you all face is to bring efficiency and cost effectiveness to what you are doing so that you could scale up. The COP helps by creating a facilitated space in which you have an opportunity to share and learn and explore opportunities of partnership. However, I must caution that the learning process will be slow, needing sustained efforts from all of us. Let us see who our COP members are. We have actors from two distinct sectors, microfinance and health. The financial service providers include microfinance institutions and NGOs and the state government. The health sector is much more diverse as compared to the microfinance sector. It has entrepreneurs and startups who have developed innovations and looking for ways to reach out to poor and rural clients more efficiently. We have researchers interested to evaluate the impact, and international agencies keen on forging partnerships and providing technical assistance and hopefully some funding support. We are hoping to enthuse the government sector also into our work. Next slide. The lead organizers, I mean to say, the Results Educational Fund and Freedom from Hunger and Freedom from Hunger India's Trust have been working to promote COP in India. And the first step we did was to develop a concept note. This was followed by identification of potential organizations to be members of the COP. Our long experience of working with the microfinance sector was a great help in identifying those players who are, in addition to financial services, who are promoting health. We scanned the health technologies and innovations to identify those which could be adopted by MFI. Altogether, 55 organizations were shortlisted, including 20 microfinance institutions and 35 health sector players. The concept note was shared with all the 55 organizations for their comments. 30 of them responded, favoring the idea of COP and promised to participate. We have also prepared the terms of reference which lists out the vision and mission of the COP as well as the roles and responsibilities of members. We will circulate the terms and reference to all of you for comments very shortly. Next slide. We conducted a listening tour of those members who showed interest to join the COP. The purpose of the listening tour was to know the views of members about the usefulness of COP to them, and also to know how much and in what way they are willing to support the COP. The listening tour was mostly through telephone calls and also a few in-person meetings. Highlights of the tour are all the MFIs and health players we contacted liked the idea and showed interest to join the COP. That's the most encouraging thing. Health players are aware of the strength of MFIs in convening the rural poor and acting as channels of health promotion. However, the health sector was not clear as to how to harness the strength of MFIs and forge fruitful partnerships with them. MFIs know the importance of health of their clients. They know that a healthy client is a good client. They know how much the repaying capacity of their clients is affected by a single health shock in the family. Therefore, some of them are already working with various health initiatives. But it is our listening to reveal to us that most of the MFIs who are promoting health are also worried about the cost involved and the ability of their staff to handle health promotion work. MFIs will be able to scale up their health initiatives through partnerships with health sectors and donors. Coming to technology innovators, we find that they are keen to partner with MFIs and implement pilots. However, their expectation is that the government or funders will come forward and sponsor a few pilots. Every one of those who we contacted expressed willingness to share their experience and knowledge and to participate in the activities of the group. Next slide, please. Many organizations we contacted listening to wanted to know what is expected of them as members of COP. We have listed the following expectations. The most basic thing is to support the practice of integrated health and microfinance, and many of you have already agreed to do that. Secondly, advocacy should be an important function of COP. Advocacy to make integrated health and microfinance more acceptable to policymakers. There are many possible areas for advocacy. For example, can we persuade a few state governments to recognize and use the extensive outreach channels of MFIs have in the form of credit groups for promoting health awareness, for distribution of simple health products, and letting the community know their entitlements of health care provided by the government. Many of the rural poor are not aware what their entitlements are. So this could be one of the functions which microfinance credit groups and SHG members could do very effectively. This is doable given the fact that the state governments have the resources and their existing extension network is weak. So there is a possibility, there is an opportunity for the governments to partner with the microfinance institutions. Finally and most importantly, members should be willing for exchange of ideas and fostering of partnerships, participate and contribute to COP effectively. Next. Next, please. Was anything missed in the summary of listening? Did you share with us anything which I failed to mention here? Or do you have any questions about the presentation so far? I think Sabina has already explained the process of sharing your questions.
Is everybody doing okay with the chat box? Or if you have a long, complicated question, you could unmute yourself. There's a microphone next to your name if you would prefer to ask your question verbally.
Hi, DSK.
Yeah.
Yeah, this is Gabriela. How are you?
Oh, hi.
DSK, I have one question, and it's not related to the presentation strictly. I mean, we have some MFI partners, and then we have some health partners. Do we have any idea of in what regions they overlap? Meaning that have we found more traction, for example, from health partners in specific states, or is more general?
See, many of the microfinance institutions work in multiple states. Say, for example, you have ESA and Equita. Though they are located in the southern part of the country, their operational areas go beyond, and it is the central and western. So we have our the COP members, operational areas in the southern part of the country, western part of the country, central part of the country, and also in the eastern part of the country. The only area that is left out is the northern part of the country. It is not existing. So it is spread out in more than 10 states.
You know what I think. I don't know what the rest think. That if we could put a map of India with the colors in the regions where we found someone, it will show the extent to which you've gone, right? To make sure that we're not just working with two states, right? And I think it would be quite appealing. And the question was in terms of health interests. Is it specific to one state? Is it as general as with the MFIs? Because it will show the opportunity, right, to where we were focusing on growing the traction from partners.
Absolutely. Right now we are working very closely in the eastern part of the country, and but the central part and the western part also are backward states, and there's much more to be done in that part of the country. And we do have the presence of some good MFIs like Equitas and these are in these areas.
I'm sorry, just to finish. That would be great because Johnson & Johnson has other partners and other organizations that they support in India, and we don't really know exactly where they work, but they could see the potential of the community of practice and the opportunity if they see like the extent of the outreach of the community of practice in the map, and then they could say, wow, you are reaching to areas where we have other partners working, for example, and this is a way in which we can connect all their work.
In one of the slides I showed, I think slide number 3, I did show a map where the 1.2 million clients have been reached, and I think that will be practically the same for the community of practice also. It could be the same.
I'm sorry. Just that would be great, and the map is visually appealing. I'm sorry, I didn't see slide 3. I jumped in the call late. It took me a while to
Okay.
But thank you very much.
DSK, do you want to jump to slide 3 just so that everybody could see the range of our partners?
Yeah.
I guess slide 4. There we go.
Yeah, these are one.
And just a request, if anybody would like to ask a question, again, feel free to unmute yourself. But once you are finished with your question, please put yourself back on mute to make sure we don't have too much background noise.
Thank you, Sabina. One question,
yes.
DSK, with respect to this map. How's the overlap with health partners? Because I'm assuming we have much more MFI partners than health partners.
Yeah. Will you please repeat the question?
I said that I really like the map. I think it's very telling. This is about the MFIs. With respect to the health partners, do we have any idea? I mean, do we have a similar map?
Yeah. Say for example, I mean, this is a very good question, and I think we need to do some more work on that. Say one example I give you is Indian Institute of Public Health, Gandhinagar, is located is our one of our COP members from the health sector, which is located in Gujarat, the western part of the country, and their operational area is Gujarat and Rajasthan. So that is where our MFI members also are working. So that's one such overlap. I think many more such overlaps could be identified, and this point we are yet to work on this point. It's a good point and well noted. I will start looking from that angle.
Perfect. And even if there is not necessarily complete overlap, what it shows is the opportunity. Where and then what we can probably, I wouldn't say necessarily add in this presentation, but present like moving forward, is making sure that those working in the same states connect. Like we want the whole community, and then we want to increase some regional connections. Like if we find a health partner and an MFI partner in the same region that have never worked together, we can introduce them and show them each other's work.
True. Yeah.
Thank you.
Particularly health partners, if they have interest in that area, maybe they have their corporate office in Bangalore, in certain part of the country, but they would like to work in Rajasthan or Madhya Pradesh. It's possible. I said this will come out more clearly when we have the stakeholder meeting, which is scheduled for 7th September at Chennai. I think when both players of both the sectors will be there, I think this can be taken forward.
Exactly. I completely agree.
Thank you. Thank you.
Okay, I guess if there are no other questions for DSK on his presentation so far, unless there are concerns that, has anybody not been able to hear? I want to make sure audio is working well for everybody now.
Sabina?
Yes.
I'm Pallavi from Chetna.
Good morning, Pallavi.
Good afternoon.
Good afternoon. Yes.
This is, I was just going through the papers, and you have a categories of health sector representatives, which is practitioners and entrepreneurs and researchers, donors and pharmaceuticals and so on. So is there anywhere documented that what all these partners will bring, because you are going to work for rural poor. So how these partners will be, or what will be their role, some criteria of selection of the partners. Is there anything developed of that kind, or it is open for all kind of networks?
See, basically the health sector, whomsoever we have picked up, one of the basic criteria is they are interested to work with the rural poor, promoting the health of the rural poor. The second criteria is they should also be interested to partner with microfinance sector. Basically, it is a community of practice of health and microfinance. So if they look at the microfinance sector to be a potential sector for promoting health, and if they see the possibility of partnering with microfinance institutions, then only it makes sense to them and to us also. So these are the basic criteria.
Okay, thanks.
DSK, I'm John Alex from Equitas here.
Alex, good afternoon.
Yeah. One question was, in the COP, getting the government to pitch in and cooperate with the microfinance will be a challenge. So I think results will play a key role in getting the government support, government health services, I mean. The second question is, there are a lot of startups who have been part of this COP. And for them, initially the cost will be a basic problem for them, getting the as they scale up, initial funding, will results be able to sort of play a key role in that?
Yeah. See, I don't know whether Ashim Roy is here in the group. I think he has promoted Uber Electronics, and I had an opportunity to hear him a few months back at Bangalore, and his question was very clear. He said that unless somebody comes forward and sponsors pilot, they have the technology, and microfinance institutions are able to have the convening power. For these two sectors to come together, there is need for the third sector, somebody to sponsor a few pilots and see how far it is feasible for testing out these technologies and involvement of the microfinance sector. And he argued that government sector, which has definitely more resources, will be the most ideal one, and we should work for that. And yes, this is the area. This is key, for our whole work. We need to have some of these pilots implemented. There's need for sponsorship, and we all have to work together, and definitely results will be working for that.
DSK, can you hear me? I'm Somen this side from IIPH Gandhinagar. Can I add to that?
Yes, Somen.
Just a response to what Alex was mentioning about the startup initiatives and how to find partners for that. So Department of Science and Technology under Government of India has created a lot of innovations and forums to support startups, and there is something called Technology Business Incubator, and probably one of the ways to basically fund those startups, which would require initial support for say 2 to 3 years to test new technologies through which we can deliver better health programs. We can get support under DST's funding mechanism, and that is a sizable amount of support which basically nurtures for 2 to 3 years. We need to basically create that center. I was actually talking to DSK some days back that IIPHG is actually thinking of applying for the Technology Business Incubation Center. We can basically see that how this COP can play a role, what sort of initiatives we can seek support under this DST mechanism. But this is one of the forum where we can seek support for the startup initiatives within the health sector.
Excellent. I think this absolutely. I think this should be the role of the COP. Thank you so much. Thank you so much for that.
Thank you, dear.
Good lead. Yeah.
Any other questions or comments, suggestions to contribute? And if you are finished speaking, we please request that you put yourself back on mute to limit the amount of background noise. Thank you very much.
Sabina, can I say one last word?
Please do.
Yeah. Hi everybody, I'm John Alex here, and we have been working with the government and startups in taking healthcare to the huge client base that we have, and it's been working wonderfully well, and I think it's very much doable. This has to be scaled up in a huge way, and I believe DSK is organizing the program in Chennai on September 7th. So we will be in the host city. We welcome you all. And one of the things, parting piece of thought that I would like to leave here, we did a lot of studies in the microfinance space among the poor, and we found that the major reason or the major pain point for them was health. And the major reason for over-indebtedness or huge borrowing is because of health. Suddenly there's a health crisis in a small family, and they really over-borrow to take care of that, and ultimately they have a huge problem. So if we could really help them in accessing health services, it will be a great service to the poor. Thank you, and welcome you all to Chennai on the 7th. Hope to meet you all on the 7th of September. Thank you, DSK.
Thank you, Alex. Thank you. Thank you. Okay.
Yes, I think you can go forward.
Yeah. Jesse, can I have slide number 10?
It's up.
Yeah, good. Thank you. Yeah. The activities that are planned for the COP are we will organize thematic learning webinars at regular intervals in partnership with our members. This is a sort of a curtain raiser where we discuss the modalities of COP, but more and more technical information will be coming. And then we will be having the next webinar in the last week of July. And the two of the members, Mr. John Alex of Equitas and Dr. Manjunath of SKDRTP, have agreed to lead this webinar. Equitas, with nearly 2 million active borrowers, has a lot of health initiatives. They run clinics, they run telemedicine centers, and they link many of their clients to nearly 900 private hospitals spread across the country for consultation and treatment at subsidized cost. They also provide health education. So Equitas believes in scalability and sustainability of all their initiatives, including the health initiatives. So Mr. John Alex will be sharing with us about these initiatives in the next webinar. SKDRDP, the biggest NGO MFI in the country with more than 3 million active borrowers, operates in all the districts of Karnataka state. Dr. Manjunath will be talking about the Shuddha Ganga project, which is a public-private partnership project to provide potable water to villages in a sustainable manner by collecting a modest fee for the water supplied. Secondly, we plan to work with you to produce blogs documenting successful efforts. We also would like to explore the possibility of writing case studies. We need to constitute an editorial team for this purpose and invite your expression of interest to join the team. We will work with you to identify joint fundraising partnership opportunities. This is very important task we should be undertaking. I think already we had some discussion about this, and some of you have expressed the need for looking for this kind of funding opportunities. We will be discussing more about this in our stakeholder meeting scheduled to be held on 7th September at Chennai. Equitas Microfinance has kindly agreed to provide us all the logistic support for this event. You are all requested to attend this first annual meeting for the COP members. Next, it is important to catalog the various publications and documents that are already available in India on the various health innovations and the efforts of MFIs in promoting health. As a first step, we have compiled a resource library of the resources developed by Freedom from Hunger and Results Educational Fund. This document catalogs the health education modules, videos, technical guides, and research publications that are of Freedom from Hunger that are available free of cost for the members of the COP. This includes the education modules. The resource library will be a living document, updated at regular intervals, adding the resources of other organizations also. We are considering formation of a technical committee of members for selecting the documents to be included in the resource library. Yeah, these are some of the steps, some of the activities we have planned for the next 4 or 5 months. And thanks for giving a patient hearing and listening to this presentation. We have, I think, a few more minutes in this seminar, and if there are any questions, we'll be happy to answer them to the extent possible. So feel free to either unmute and talk or send the questions through the chat box. Not only questions, but if you have any comments or suggestions, We got excellent suggestions from Alex and Soman. And Soman, the suggestion about approaching DSC is really encouraging. We should take it forward.
DSK, this is Ashim. As we exchanged ideas earlier, I still believe that we need to do a lot more trials with healthcare ideas to address the issue of these sudden healthcare costs that puts the families back into poverty. So if you could please think about that a little bit, we will discuss further on 7th of September when you meet.
Absolutely, sir. Absolutely. I remembered your email, and I made a special mention about that because that's the most important function of the COP.
Everybody, if anybody is interested to have the link that Showman mentioned earlier, he's posted that into the chat area. So if there are not any questions, DSK, would you like to go through the terms of reference? We could review. All right, so I think if everybody can see, this is something we've prepared and we'll be sharing with everybody after this session to get your thoughts. Your feedback through the listening tour really is what has given input into how we develop the terms of reference. You just want to briefly walk through the contents of the terms of reference?
Give me a couple of minutes.
This is Shomitra. Can you just enlarge this terms of reference? We can't see it properly.
Actually, you can go on top, Alex, here of the box and see a minus and a plus. If you plus it, it will get enlarged.
Thanks,
you.
John. Yeah, thanks.
Yeah, the terms of reference, we framed with a mission to ensure access to comprehensive, high-quality healthcare and sustainable management of water and sanitation, particularly for women, adolescent girls, and children, by aligning the strategies of microfinance and health sectors and catalyzing collective action. See, one of the important objectives of the community of practice is to identify, gather, and seek agreement on the community's requirements, to provide a forum for the cooperation of activities where COPHAM adds value to existing initiatives. And one of the important things is financing for health. I think that is to be added to our efforts. There is a lot of scope with the new small banks coming up. Is there definitely more scope for health financing? There are already a few microfinance institutions which give loans for health at a slightly concessional rate. And health insurance, there are some efforts from some of the agencies to involve communities in developing their own health insurance product. I think that also has to be factored in our efforts. And whenever I had meetings and discussions with potential members, there was also a mention as to what should be the will they be required to pay some fees to become a member of the COP. I don't know. These are the things which need to be discussed and decided when we meet in the stakeholder meeting, and what should be the responsibilities of the members. And some of these aspects have been gathered and put in this terms of reference. we have said that what are the criteria for becoming a member. It is not a membership for the individual, but it is membership for the organization. That is one thing. And the most important criteria is the members support the concept of microfinance and health promotion. And they should be committed to collective action to promote WASH and women and child health. And participate in all the activities which we will be having, like webinars and blogs and case studies, annual meetings. Another important thing is how do we document the case studies. So we will be happy to help, but the initiative has to be taken by the members and draft some of the interesting case success stories they have. Yeah. I will be sending the terms of reference shortly and seeking your comments on that.
Hello.
Yeah.
Yeah. Hello, everyone. This is Sandhya Suresh from ESAF. And
yes, Sandhya.
So ESAF is also working in the rural communities, and we reach out to almost 1 million clients across 10 states of India. And we have been working very closely with Microcredit Credit Summit and results for the past 5 to 6 years. And we really look forward to working closely with other stakeholders as well. And my experience is that if we work together, we can achieve a lot, because microfinance institutions as such do not have that skill set or the know-how to implement a health program, but they do have the will and the passion to work for their poor clients. And recently we have just started an anemia control program in Chhattisgarh, and our experience of seeking health support from the primary health centers was not so good somehow, and we thought probably working closely with your group, we can extend some meaningful results to our community. Even though we didn't get any good support, we are still going ahead with whatever know-how we have, and we are using the module that was given by Freedom from Hunger in this. So I think going forward, COPTAM will really be able to come across to us as a good model of offering something very sustainable to the communities. So thank you so much, and we look forward to meeting for the stakeholder meeting as well.
Yeah. See, the potential of the, thank you, Sandhya. The potential of the microfinance sector is amazing. Even our partners now, including Bandhans and the Ispitas and the ESAF and these partners together, they are reaching out, back of the envelope calculation I make, they are reaching 14 million microfinance clients, and that is translating to nearly 70 million population. And the beauty is almost all these clients are poor, they are women, and they are rural. So this is the constituency which I am sure the health sector also will be interested to reach out to. So that is a great strength of the microfinance sector.
Yeah, hello.
Yeah.
Hello, everyone. Yeah, it's Richa this side. I'm from Bagdhara.
Yeah, Richa.
Yeah, I just want to, I have a concern. Like, this is a very good model for microfinance and health, but my concern is this, like, basically we are working in the tribal area, and as you just mentioned that financing for health, so like will it be loan based or exactly like what kind of financing, so that because will it be a challenge for us?
The financing here is not only credit, but it includes savings, it includes loans, it includes insurance, health insurance.
Yeah,
for example, if you are working in the tribal area, if
Yeah.
you are able to motivate this, lot of background noise, if you are able to motivate, if you are able to motivate, if you are able to form groups of the poor women and motivate them to have savings for health. See, anyway, a self-help group saves, but if you give them, if you give them the motivation, saying that, look, why don't you save for a specific purpose? You know, they are motivated to save more. So we have seen that this is happening elsewhere. So you can encourage them to save for health.
No, but this seems fine, but like there, as you already mentioned, and I would also tell you, like as they're already saving just for starting up a new business or for just as a source of income, then they don't have enough of money that separately they could save for health, or so there could be other options we can explore.
Hello everyone. Hi.
Hello.
Hello.
Hello. Hi, this is Gunashekar.
Yeah, Gunashekar.
I just wanted to pitch in here. One of the things that everyone is talking about is financing healthcare, but actually we have been running these healthcare initiatives for these women beneficiaries right from 2006 onwards. And what we see is there's lots of facilities that's already existing in the system, but people are not linked to it.
Not aware of it.
Not aware of it, exactly. And what is happening is we are able to successfully help them out just by linking them to these different facilities that is available. And we have been able to do lots of open heart surgeries, cancer treatments. See, any problem from head to toe, we are able to help them out in different ways just by networking with all these healthcare providers and these schemes that has come out from the government and the different organizations, the different NGOs running the healthcare initiatives. So I think we have the resources there, but right kind of linkages and awareness is what is lacking. So maybe
absolutely. Gunashekar, you are from which organization?
I'm from Parinam Foundation, but I also take care of healthcare for Ujjivan.
Oh yeah,
services.
Yeah, you are absolutely correct. There is no awareness. There are not. There's so many facilities. They're eligible. They are not aware of that. Even creating that awareness is a good contribution.
Right. I think this is what we should be able to work on, and then build up some manual kind of a thing or something and distribute it among the people and start creating awareness on these facilities.
We have an interesting training module developed on this.
Yeah.
I just want to pitch in and want to add like linkages. I completely agree with you that there are a lot of resources available, but my concern was just for health financing. That's it. Now, okay, thank you.
Good.
Mr. Rao, this is Akshat with UE Life Sciences. How are you, sir?
Yeah, good afternoon, Akshat. Glad you are there. Good. Yeah, Akshat has a very...
I'm one of the few health. I think one of the things that we're interested in is partnering with MFIs to enable health provisions for the poor is fantastic. As a for-profit health provider, a medical device company that we are, for us, I think consistency and transparency of revenue and just an ability to work with the population on a sustainable basis would be very interesting.
Good.
Yeah.
Do you think MFIs have the they will be able to do that?
I think, as you said, Mr. Rao, I think as a channel partner, they're great. I think I would love to see how we can work with MFIs to create a sustainable model where I think dependency on government isn't the sole way of financing this. That's just the way we look at it. We are working with, or we're trying to work with many government agencies, and as we all know, that they're not the most consistent providers of funding, and they aren't the most reliable partners to build scale. Right, and I think ahead of this, there was a talk about going to government grants. Not all startups are in the same phase. We are while we call ourselves a startup, we're definitely in the commercial phase. and we are looking for partners to implement our device, not necessarily to test our device. So the grants, such as the government grant that was mentioned before, isn't necessarily that would work well for a company where we are, where we're looking to engage with MFIs to actually start commercializing and implement our product. To improve, we are an early detection company for breast cancer, for instance.
Yeah, true.
So we'd love to engage with everyone on the 7th and see how we can come up with a good model.
Excellent.
GSK, we've got a question. I'm not sure from whom this comes, but what is the role you see for WASH, and at what level, household, community, health facility, school? Sorry, this is from Arundhati.
Yeah. Okay. Bhattacharya.
Yes.
Yeah. So, for example, there are some MFIs which have very successfully implemented WASH programs. There are a lot of challenges in that. There's no doubt about it. Say, for example, Grameen Kuta in southern part of the country, they have financed more than 100,000 toilets, and though there is a good subsidy for creating a toilet, and government of Karnataka, it works well, but still Grameen Kuta's loans given upfront for the construction of the toilet has really triggered the action, and people have gone for the toilet. Expecting them to spend for the toilet and then get it reimbursed later by the government is time consuming, and they are not interested to do that. So MFI loan really helped them to do that. So like that, though there is a lot of subsidy available, MFIs do have a role in identifying, encouraging, promoting, and also financing for construction of toilets. And similarly, about even promoting the idea of hand washing and giving them education about the importance of hand washing, giving them education about the importance of treating the water filters. I see role of microfinance in all these fields, both in water, sanitation, and hygiene. So you may be wondering what role MFIs have when the government is giving a subsidy of 12,000, 14,000 for the toilet,